Science Journal for Kids and Teens presents How Many Lives Do Vaccines Save? Adapted from the original peer-reviewed paper in the journal The Lancet, published on January 1st, 2021. Research conducted by scientists involved in the Vaccine Impact Modeling Consortium. See the full list of authors and their affiliations in the accompanying PDF. Read by Miranda Wilson. Abstract. Ever since their creation, vaccines have saved countless lives all over the world. Still, people in many countries suffer from diseases that could be prevented by vaccination. We looked at 98 countries where a lot of people are infected with such diseases. We wanted to measure the benefits of vaccination for them. Using mathematical models, we found that vaccination saved 37 million lives between 2000 and 2019. We project that it could save 32 million more by 2030. Introduction. Have you ever heard of smallpox? It's a dangerous disease that once killed millions of children and left many others scarred for life. Thanks to the first vaccine ever developed, smallpox is now gone from our planet. Scientists have developed vaccines against many other infectious diseases, including COVID-19. As a result of routine vaccination programs for children, most of us are now protected from dangerous diseases such as measles and rubella. Even better, when enough people in the population have immunity against a disease, the rest of the population is also protected. This is called herd immunity. Organizations like the World Health Organization and Gavi, the Vaccine Alliance, support vaccination activities in countries around the world. With their support, during the last decades, immunization in many countries has expanded. But how many lives have vaccination programs saved? Will they continue to save lives in the years to come? This is what we wanted to find out. Here is an image of hospital staff lined up to receive yellow fever vaccines before seeing patients in Sudan in 2012. Methods. We wanted to estimate the impact of vaccination against these 10 diseases in 98 countries: hepatitis B, measles, rotavirus, yellow fever, rubella, 2 types of bacterial meningitis, Japanese encephalitis, the leading cause of pneumonia, and human papillomavirus. The period we focused on is 2000 to 2030. We created various mathematical models to help us figure out how many lives these vaccines saved. Our models considered the demographic data from each country, how many children are born each year, how many people die, and at what age, etc. The vaccination coverage for each vaccine in each country, we'll see that in Figure 1, the efficacy of each vaccine, and different scenarios for future vaccination coverage, i.e. do more or fewer people receive vaccines, and so on. We also had a no vaccination scenario. What would happen if there was no vaccination at all? This let us estimate the impact of vaccination programs. Here in Figure 1, you can see that vaccination coverage in the 98 countries has greatly improved from 2000 to 2019. The maps show the average number of vaccines received by a child born in 2000 at the far left, 2010 in the middle, and 2019 at the far right in each of the countries. Darker orange colors indicate average vaccine numbers closer to 0, while darker purple colors indicate average vaccine numbers closer to 8. Results. For the past 2 decades, 2000 to 2019, vaccines have reached a lot more children than in previous years. In the 98 countries we considered, this has led to 37 million lives saved. Out of these, 36 million were children younger than 5 years old. In the next decade, 2020 to 2030, we project that the vaccines will save 32 million more lives. 28 million of them will be children under the age of 5. Our models also allow us to project the impact of vaccination on different age groups. For example, during the lifetime of children born in 2019, vaccination will prevent 72% of the deaths caused by the 10 diseases. The vaccine against measles has the largest impact. In the period between 2000 and 2019, it has saved 33 million lives. We estimate it will save 23 million more lives by 2030. You can see this in Figure 2, which shows the number of deaths averted or lives saved thanks to the vaccine against measles. The graph shows the number of deaths in millions on the y-axis and the years ranging from 2000 to 2030 on the x-axis. In orange, you can see that the number of deaths continues to increase without vaccination for measles. In purple, you can see that the number of deaths continues to decrease to a low level with vaccination for measles. The shading for both of these models represents uncertainty in each model's predictions. Can you use the graph to answer this question? Approximately how many people would have died of measles in one single year, for example 2010, if there had been no vaccination? The vaccine against human papillomavirus, or HPV, has great potential as well. HPV can cause cancer, but it usually takes years and even decades to develop. Thus, we will only see the positive impact of vaccination against HPV in the future. However, the model projects it will be large. Increased vaccination against the leading cause of pneumonia would save the most lives of children under 5. Discussion. Our findings show that vaccines have saved and will continue to save millions of lives, especially children's lives. This is why it's important to sustain and even expand the current vaccination programs across the world. This is especially true for vaccination against HPV. This virus is the most common cause of cervical cancer, which usually kills women over the age of 50. The more children receive the HPV vaccine now, the more people will survive decades from now. In addition, increased vaccination against the leading cause of pneumonia would greatly reduce children's deaths. It's important to say that the impacts of vaccination vary among the different countries. This is mainly due to different vaccination coverages. Protecting and increasing all these benefits depends on continuing vaccination. Countries need further funding for these programs. Additionally, governments should educate citizens and promote immunization programs so that people trust the vaccines are safe and efficient. Conclusion. During the last few decades, we have also seen more people hesitating about vaccination. Their main concern is the safety of vaccines, but scientists all agree that vaccines are not only safe and effective, but also vital to protect everyone. That's why it's really important to make sure you and everyone in your family gets all the required shots. Thank you for listening to this recording. Visit our website, sciencejournalforkids.org, for more free science teaching resources.